Oh, jeez, here we go. Oh, you guys, where'd you live without technology? What would you do? All right, so you have your PPE, and you want to bring that for checkoff. You're not going to use it, but you want to identify that you're prepared. Because why? Why would you want PPE?
Because when you're irrigating.
Yeah, because you're going to irrigate. So I'm going to set this aside, knowing that you'd have to have that. You have your tape. You have your measure. Because what are you going to do with the measure?
Measure the size of the wound.
Okay. Inches or centimeters?
Centimeters.
Yeah. If it's inches, you're in bad trouble. Okay. So what I do, you could just kind of, hopefully it's not any larger than 4 inches. Oh, I don't want to use that tape. You guys cut that special.
Here.
No, I got it. That's just a puny little thing. Okay. There we go. So the big thing about setting up for wound care is that you have enough room to put everything. Okay, we have my irrigation kit, my saline, you got the blue pad there, your super sponge, your 2 Q-tips, your 4x4 ABD pad, and I don't have sterile gloves.
And pause.
I apologize because you guys really want to practice this stuff. And does he have a, yeah, he has a genital, she has a genital, so we can just move right into folding. Okay. These are, all right, let's begin. So you have your guidelines?
Yes.
All right. So I've confirmed the order, I've looked at the chart, I'm gonna walk to the room, I knock knock, how are you doing today? My name is Peggy, I'll be your nurse today. How's your, I'm gonna be changing your dressing, or what didn't I do? Confirm the ID, right? 2 forms of ID. Hey, I'm gonna be changing your dressing today. How does it feel when they change your dressing? Do you have a lot of pain with it? No. Do you have any pain now? No. Do you need anything for medication? Do you need any medication? No. Okay, so we're good to go. So I've confirmed, positioned my patient, made sure they're comfortable, made sure it's good to do the dressing. Now I'm gonna remove the dressing, right? How do you remove the tape?
Push and pull.
Push, pull, push, pull. You don't want to tear the good skin, and the tape will do that really easy. That's why you always use paper tape. Push down on the skin and lift up the tape. And you just go the whole way around. I'm doing it very fast, but you would do it gently. Lift up the tape, push down on the skin, lift up the tape. Push down. This is really gooey. Push down. And then just bring it all to the middle. Okay, if you can pick it all up, that's fine. But if it doesn't come out, just pick up your ABD, set it here, and it's still there. It may be really dry, so what are you going to do to remove it if you go like this and it sticks?
Moisten.
So you take your irrigation water or saline, moisten it, remove it, and then, like you guys all said, what does it look like? What does it smell like? How does the bed of the wound look? And you would describe that. Now you're going to remove your glove, glove to glove, skin to skin. And you have your garbage right there. And you drop it. Now I'm going to wash my hands. Now I'm going to put sterile gloves on, right? Because it's a sterile procedure. Actually, it's an aseptic procedure, but you're going to do it in a sterile manner because you don't want to cause any more contamination. So you're going to set up a sterile field in your room. Loosen your water. Here's your supplies. And then tell me what I do first.
Don clean glove on dominant hand. Open sterile cotton tip sterile cotton tip applicators. Without touching the wound, use 1 Q-tip to measure length and width. Discard. And then use your second to measure depth and then discard.
Okay, so there's 2 in 1 kit. I'm going to open it up. One I'm gonna measure with. So how do you measure? In what order? Always the same.
Length and width.
Length, width,
Then
and
depth.
depth. So length, I'm gonna go from the longest point. So the longest point, without touching the wound, is about to there, and you would measure. So it's about 12 centimeters.
And width.
Now I'm going to measure the width, the widest part. Okay, about that. Now you're not going to be exact, but you want to try to be as close as possible. And what was the first one I said?
12.
12. And then the depth, the width is 7 centimeters.
And then
Now you
depth.
discard this, right?
Yes.
And now you're going to do the depth. You go up to the deepest portion, probably right here in the middle where the bone is. Not touch the wound. And same way, slide your fingers down to about the depth, and the depth would be 4 centimeters. Now I discard this, right?
Mm-hmm.
If there was tunneling in a wound, you're gonna have, do you know what tunneling is?
It goes under.
Yeah, so around the wound, this wound may be going under here and you don't see it. So how do you check for tunneling? You start at the head, which is 12 o'clock. So you go 12 o'clock and just gently go under here. There is some tunneling. Its depth is, you know, just guesstimate that, eyeball it, so you remember that's pretty deep. Tunneling at what time?
1 o'clock. I
About
think
1
you touch.
o'clock.
You have to
And you
touch,
just
right?
go 2,
Yeah.
3, 4, 5, 6, 7. Oh, there's some under there. Tunneling at 7, that's a little bit bigger. So that's actually about 5. Okay, that's at 7, 8, 9, 10, 11, 12. Okay, and that's how you would say if there's tunneling, that's where you would record it at 7 o'clock, approximately 5 centimeters.
deepest
And
part?
then again at 1 o'clock,
And you
at
kinda
approximately 3 centimeters. Okay, so there's your tunneling and examining the wounds. Now we're going to go to what?
You're gonna don your PPEs, gown, and your eye cover.
So if you needed that, you would don it now. What's next?
Prepare your work area. Loosen your normal saline. Open your Q-tips. Tape to side of table if needed. Open your irrigation set and tuck flap under the pan.
Okay, I should have 2 of these. I don't do that, right? All right, I've just opened my clean, sterile Q-tips or cotton-tipped applicators. So I'm going to put those on the side so I'd be able to get them when I need them.
You loosen the cap of the saline.
So I'm going to put them so somewhere where I'm not going to reach over my sterile field. I'm going to put them right here. And that way I can access them easily. Okay.
Open irrigation set and tuck under.
Okay, so open your irrigation kit. You always go open it away from you. Start
Bless you.
Excuse me.
distal, proximal.
Thank you.
So you would open it.
Towards you?
Away
That
from
was
you.
away
I thought it was
from you.
away.
You said
Like
away
this?
from you?
So
Would you just open it towards you?
distal.
Yeah. And tuck.
Like that, right? Yeah.
Open your super sponges and tuck flap under. And then open your sterile gloves.
This is the hard part.
open your abdominal pad and drop onto the sterile non-dominant glove.
Okay, so I'm keeping away from my sterile field. And this is and so I am my non-dominant hand.
Non-dominant. And then open.
So big.
Big one is hard.
So that's too big. It went off on my sterile field. How do I know?
One
One
inch.
inch. The 1
Water.
inch.
So I'm gonna drop it again.
The big one is hard.
Okay. Next.
Open your 4x4s and drop onto the abdominal pad. Don your sterile glove onto your dominant hand.
Okay.
With your dominant hand, place irrigation set upright in box. Place your syringe on sterile field.
Whoa, what was I doing?
You cross.
You cross your sterile field.
Okay, so now, back up. Got my dominant hand glove, now I'm gonna come over here, pull my syringe out and set it right here.
Okay. Remove one super sponge and place on sterile field. With dominant hand, place, with non-gloved hand, palm your normal saline on the label side.
Now you can set it up comfortable, okay?
And pour solution into your irrigation container. And into super sponge tray with sterile technique. Recap the bottle. Don your second sterile glove.
I'm gonna put this.
Work your syringe to loosen and withdraw normal saline from set. Okay. Irrigate the wound from top to bottom, side to side, or clean to dirty.
Top to bottom, side to side, clean
To dirty.
dirty.
When irrigating, use moderate pressure and keep syringe tip at least 1 inch away from the wound.
Okay,
Irrigate until it's clear.
okay.
Pick up the dry super sponge from the sterile field. Grasp the four corners. Sorry, my accent coming out.
Gotcha.
Grasp the four corners of the gauze together. Grasp between your index finger and thumb of dominant hand and gently dry the intact skin border of the wound clockwise. Then discard. Place the moistened super sponge directly over the wound, making sure the moistened gauze does not touch the intact skin.
Okay, so you're gonna need to pull it apart a little bit, but you're not gonna do that whole twisting, wrapping, bending, flipping. So you'll pull it apart a little bit, try to keep it contained, all right? Just kind of unthread it with your hands, keeping it in your gloved hand, making sure that it's not dripping on your sterile field. And now you're gonna loosely put it in, right? Into your wound. Set it in there. And now what do I have to make sure?
It's packed in.
Yeah. So if you're good with chopsticks, one of my students did a really nice job with chopsticks, and I'm not good, so she was able to manipulate this to cover all of the tissue, right, that needed to be covered. So as you can see, this is a deep wound. You'd have to have 2 super sponges. Okay, so it's on the tissue that needs to be on. It's not out on the intact skin. So you would need another super sponge to kind of gently pack it, but not overpack it, not real tight, and not up over the level of the skin. Okay, so I've packed it in.
Cover dressing with 4x4s and abdominal pad. Prepare tape.
I'm going to pick this up. I want to make sure that I open it up and hold the blue line outside. Now I'm going to remove my gloves and put the tape on. Just tab a corner and window tape it, yeah? Paper tape doesn't stick real well. You have to keep your hand on it to sort of melt the glue a little bit and adhere to the skin. So I tabbed this corner, don't have to tab another corner. It's called my courtesy tab. I got the tape over a little bit too far on the ABD pad, so I would add another piece here. Over top of the tape that's already there. Just a little bit on the skin, conforming it, your finger, and finish it up, yeah? Okay, what else do I have to do? Somebody else, tell me what I have to do.
Label of the dressing.
Yeah, my name and initials on the dressing, and the time. So for the sake of checkoff, they do not want you to tear paper tape. They want it nice and cut, and you're going to tab a corner so that you know where to begin. So I would put my initials and time, not over the wound, not over the center of the pad. Why?
Could saturate and lose the time.
Yeah, well, you'll obstruct the vision of if there's drainage or not. So just tab it over here and write your name, initial, and date. Who has a pencil?
Thank
Pen.
you. Open.
So it's 11, 7,
So it's easy to peel.
14,
Yeah?
Yeah. It's like,
12.
Okay. Just for decoration.
I thought you had to tag every
You might use that pretty blue, but it's a nice blue. All right, and that's the Wnd Care. Now we're going to move into the food.